Hi there, this is Dr. John Whitcomb talking about treating high blood pressure naturally. Drink more water. Okay? We have lots of advice columns that say you should drink more water. And many people say yes, you should. But there are lots of skeptical doctors that say hogwash, you can drink as much as you want and your thirst will make it up for you, and there's no proof whatsoever that that helps one way or another. Well, let's talk about that. First of all, let me do a small explanation of just how your water system works. You have a gradient from your blood to the outside world that you have to get rid of stuff. So if your concentration is high and you have lots of water to put it into, that's easy. Whereas if you have very little water, then you have to make a very high gradient. And so you have to have a lot more work to push it across and concentrate stuff. So when your urine is very dark, brown, yellow, whatever, that means you're really concentrating and you probably haven't urinated for 6, 7, 8, 9 hours. Whereas if it's very dilute and looks absolutely crystal clear, it's because you've been drinking enough water to flush it out. And that takes less work. Well, there's abundant evidence from the 1980s and 90s that the thicker your blood is, the stickier it is, and the more friction it has on the walls of your arteries, the more damage it causes. And so folks with high blood pressure, sure enough, have stickier blood. And that correlates then with higher rates of inflammation and more coronary artery disease, so that all goes hand in hand. Now let's do another segue. 25% of the population has an illness called CIRS, chronic inflammatory response syndrome, and they have a broken antidiuretic hormone system. They don't regulate, they can't measure and respond with adequate ADH. So in effect, what's happening with them is they're leaking out the bottom. Their bathtub is emptying, so their balloon is never full. So their blood pressure is low. In fact, many of them have been diagnosed with POTS syndrome, POTS, which stands for postural orthostatic tachycardia syndrome. And their poor hearts are just frantically beating very quickly, trying to keep their blood pressure up, because their tank is really only 80% full, because their kidneys simply can't respond, because they have no diuretic hormone, almost proving the point in reverse or opposite, or a false negative, or whatever. But back to drinking enough water. Dr. Chan published a brilliant study in the Journal of Epidemiology from the Loma Linda study a couple of years back now, in which he showed that folks who drink 5 glasses of water a day versus folks who drink 2 glasses of water a day have half the cardiac mortality. Did you get that? Half the cardiac mortality of people who only drank 2. And what happens if they drank flavored water like milk or soda or tea? No effect. No effect at all. Had to be pure water. Why did it have no effect? Well, milk has a lot of milliosmoles in it that you then have to pee out against a gradient. Doesn't that make sense? Pure water. You want pure dilute water so that your kidneys have something to put that junk into. What will work for me? Well, I'm now drinking 1 big glass of water every morning when I brush my teeth just to get started. And I'm trying not to have quite so many cups of tea during the day. Just drink a glass of water. And if I go outside to work in the yard, I'm drinking a big glass of water before I go out, so I don't get dehydrated. We'll see what it does. My blood pressure is normal, but I want to give my kidneys an easy time of it. You can do that too. Try to find ways to drink more water. If you can drink 5 glasses of water a day, half the mortality. Go for it.